My name is Aleeza Hashmi, and if selected as the Girls 20 Summit delegate from the United States, I will use my voice to improve the health education and services available for women regarding the greatest killer in the world, HIV/AIDS. Currently, there are over 34 million people in the world afflicted with HIV/AIDS, and 26% of all patients are women. Why does this matter? Even though this may appear to be 1/4 of all patients, this has a huge ripple effect and affects all aspects of society. We all recognize that women are the epicenter of the family and of society. Oftentimes, we say that female empowerment can come through political change, social change, and economic power. And while this is true, we cannot expect women to care for their families and maintain jobs if they do not have their health. Health is a primary issue. I believe this issue is also cyclical, meaning that if we are to address this problem, it should be two-pronged. One being awareness regarding mother-to-child transmission of HIV/AIDS through breast milk. Furthermore, there isn't even knowledge oftentimes of how transmission occurs. It is not always socially acceptable to talk about the fact that HIV/AIDS is a sexually transmitted disease. Even when women ask for HIV/AIDS treatment, they are fearful because of possible stigmatization and ostracization of their husbands, their families, and of themselves. For example, in Botswana, 70% of the population of the ages 18 to 40 are afflicted with HIV/AIDS, yet women still will not ask for treatment. In China, stigmatization is a huge issue. I believe that making HIV/AIDS testing an annual and free service in all countries as part as just the general checkup for the populace, we can address this primary issue of stigmatization and ostracization. This requires a cultural shift and a cultural change. For the past 10 years, I've been working with the Citizens Foundation, which is an organization that builds schools in the most impoverished areas of Pakistan. I chose this organization specifically because they provide a health education class for young girls, starting in the 5th grade. Furthermore, I realized that I wanted to merge my passions of medicine and global health. And I did this by interning at the Johns Hopkins School of Medicine, the University of Maryland School of Pharmacy, the UN, and the British Parliament. These experiences were eye-opening. I believed that policy change was the key to success and was the key to helping women with this specific issue. However, what I quickly realized is that it takes unity between the private and public sector. It takes grassroots movements, it takes people at the highest level to implement change. Policy is not just enough. Advocacy is what really matters. When I came to Harvard College, I joined the Global Health and AIDS Coalition. It is an advocacy policy group, and from this group, I learned the skills needed to really implement change.